Welcome back to the second video in the series, Let's Get Rid of IBD Once and For All. Hi there, I'm Trevor Robinson, herbalist, nutritionist and director at The Gut Guru. So you've been given medication for helping manage your Crohn's, colitis or other gastro-related disease, or anything else for that matter. But do you really know what that medication is doing to you? Before we go on, let's make one thing clear. At The Gut Guru, we are not anti-medication, nor do we suggest you should stop your medication without consulting your doctor or specialist. What I do want to do is ensure that you have a fuller picture of the risks for some medications used in particular treating Crohn's and colitis, but also something to be aware of anyway. Covering all the possible medical pharmaceutical options in this video is just not practical. What I am going to share with you is a case at the Gut Guru Clinic that highlights a need to be informed of what you are taking. For privacy reasons, some details can't be shared. Well, it's kind of obvious really, isn't it? Anyway, we had a lovely young lady in her early 30s who had access to good information, had a lot of concerns about the medication she was taking for a Crohn's treatment, and was looking for an alternative, even whether an alternative was possible that could eliminate them. Two drugs were involved, mercaptopurine and allopurinol. Now the MIMS literature doesn't even mention Crohn's as a reason for the prescription, and MIMS is the Bible doctors should be using for prescribing drugs. The drug combination was being used off-list by a specialist as it was thought that the combination is effective for the treatment of Crohn's. Mercaptopurine is listed for acute lymphocytic leukemia, and allopurinol is listed for gout. This is rather two very different diseases, so why take the drugs when they appear to have nothing to do with Crohn's? Well, research suggests they do have some effect when combined. However, the same research also found in 1/3 of patients mercaptopurine had absolutely no effect whatsoever. Unfortunately, the studies were relatively limited as they had rather small sample sizes. That doesn't sound too bad, does it? However, what about the side effects? Does the positive effect of taking that medication outweigh the negative? Mercaptopurine unfortunately has two common and rather unpleasant side effects. The first is it will cause cancer. Secondly, it's a hepatotoxic. In other words, it'll poison the liver. With such common and serious side effects, one would wonder, do the benefits truly outweigh the side effects, in this case taking those medications? Allopurinol is a little nicer. Its side effects are an upset stomach, diarrhea and drowsiness. One would have to query here, why take a drug that causes diarrhea when diarrhea is one of the problematic symptoms of Crohn's disease? In 2 years of taking the medication combination, this charming young lady still had no relief. Cramp attacks would last for hours, still had panic toilet runs, still had to keep strategies in place for finding toilets wherever she went with whatever she was doing. While there was some control, it was certainly a far cry from being a good resolution for her. The herbal solution for this young lady was a combination of astragalus, wild yam, bayberry, St Mary's thistle and pau d'arco. Since then we've done a few tweaks, but this combination reduced the inflammation, modulated without suppressing the immune system, reduced TNF-alpha and repaired hepatocyte damage to the liver caused by the medication she was on, eliminated mucus in the stool and assisted the body to repair the mucosal wall. So far we've achieved near enough full remission of symptoms. And now 5 months later they've reduced and eliminated the prescribed medication. I'd say that's a pretty good answer from a natural approach. Other key medications used in colitis, Crohn's and other inflammatory related type diseases are corticosteroids, immunosuppressants and NSAIDs. That's non-steroidal anti-inflammatory drugs. Now, corticosteroids. These guys are simply awesome at suppressing inflammation. But as you'll remember from the real secret with inflammation is elimination, not suppression. All corticosteroid production in the body is stopped when you take corticosteroids, and it can take over a year for the body to recover. Plus, many get sick more easily, gain weight, have mood changes, mood volatility, and then there's the hidden side effects, including the stripping the bones of minerals, creating osteoporosis, and the risk of developing diabetes, which is actually extremely high. Now, the immunosuppressants. Simply, the immune system is being suppressed. They're stopping it working. So that doesn't respond and attack the body. Pretty good idea. Unfortunately, this also reduces your resistance to illness and increases your risk of becoming ill. Not a particularly good side effect, I would think. There are risks of medications used in Crohn's and colitis, and you won't always be told about them, though it is why you have so many blood tests. It certainly doesn't have to be that way. Management of Crohn's and colitis can be achieved naturally. Natural solutions can work in conjunction with medication so that medication needs can be reduced and reduce their impact upon you. Or you can simply ignore all this. Accept that the risks are there, or just ignore that there are any risks at all and stick with what you're doing. It's possible. It's been done. You can give IBD the kick. Make the change. Why not book an introductory consult? Simply phone the clinic on 07 3102 4363 or email info@gutguru.com.au. There's a chance that you'll discover how many of these factors affect you and whether our programs are right for you. I said a chance. The answer is you'll really find the answer of whether these factors affect you.